There is nothing more difficult to take in hand, more perilous to conduct, or more uncertain in its success than to take the lead in the introduction of a new order of things. And certainly when we're thinking about the scale of transformation, some of the finances demand of us, some of the quality shortfalls demand of us, this sticks with me. We shouldn't pretend that this is an easy task. This is difficult.
It's the disconnect that I see as a practitioner working in serving a community between the enthusiasm for change that we see amongst our leaders, which I guess includes you guys here in this room, and the complete disconnect, scepticism and often cynicism that we see from clinicians on the ground. And we're not going to break that disconnect without creating time and space for clinicians and managers on the ground to think differently.
Are we talking about workforce enough? No. In order to show the shift in the workforce that we need to model it differently. We don't want to count it more accurately. We don't want to plan it as an organisation or as a single profession. We want to look at the workforce in the round, its functions and activities, and then move into the competency area and then plan differently on that basis.
When the devolution pilots looked at what they could do, there was already a lot that they were able to do within the existing structures and that they weren't doing. And I think it's a very key message, because some of this looks radical, but actually there's a lot that we could be doing if organisations simply worked differently. And that links to capacity for the leaders of organisations to have the time and space to do things that look a little bit risky with the encouragement from the national bodies.
We are increasingly open to having a really early dialogue about changes that people want to make. And I think the earlier that we're involved in discussions about changes, new care models, I think the easier it is for everyone, because then we're also in that feedback loop about where the barriers are and where the issues are.
I would say if you're a chief executive of an institution on the provider side, we have not given you enough national support. So we've got to work out how to give support to help them provide networks to support each other and provide more support to the chief executives. What we have to do is we have to manage an efficiency agenda to manage the short-term challenge, and we have to manage and make progress on a long-term agenda in order to change a pattern of care.
We want the assurance that the people who are planning and running the services are just going to do the right thing. And what is the right thing? That has to be worked out in collaboration with those communities. Doing the right thing, I think, does mean confronting the bureaucratic mess and being prepared to take some risks in saying, well, we're pretty sure this is the right thing to do and we're damn well just going to do it. We should all be focusing on how are we going to make a difference which improves health and health outcomes and improves the experience of care for patients and their families. Let's not, because it's so easy to get distracted by all the other stuff.